said, I'm just going to try and give you in 10 minutes. By the way, Alex, has that slide shifted? Yeah,
Yeah,
brilliant.
all
Thank
good.
you. Thank you. Um, so just a very quick overview. It's 5 minutes on each, I'm afraid. So it's going to be very, very superficial. We wanted to introduce you to the context in which we're working, so urban development systems, but also to give you an overview of the TRUUD program as a whole before handing over to Neil, Judy, and Jeff. Um, so this is how the European Investment Bank categorizes all the various different infrastructures in our cities. And so I thought this was quite a useful starting point to sort of give people a kind of tangible idea of, how we think about urban systems. But obviously, as it says in the italics there, it's not just about the hard, tangible systems that obviously have an impact on our health, but also the social sort of soft decision-making systems that effectively determine the quality of each of these different infrastructures. And I'm going to come back to this slide in a second because I'm going to go down into just one of those buildings to try and just flesh out and give it a bit of nuance in terms of the complexity of each of these different infrastructure areas. But just to say, and a lot of you I appreciate will be working in this area anyway, so it won't be new to you. But so if we split up those into, say, buildings, transport, outdoor space, streets, etc. In our pilot project prior to TRUUD, we did I say we, this was colleagues at the University West of England, Paul Pilkington, who's on this call as well, and Janet and others, did a series of 5 systematic reviews looking at all these different areas and their links to health and health outcomes. And it was the quantifiable data from those systematic reviews that fed into our economic valuation. But broadly, this is how we are, I guess, conceiving of that interrelationship between those different built infrastructures and then health outcomes. Early on in that pilot project, which was called Upstream, and it was funded by the Wellcome Trust, we sort of put together this conceptualization of the problem space. Basically, this is just to say that we know already quite a lot about the human and planetary health outcomes from the built environment. There's a huge amount of evidence linking urban environments to health outcomes. It's not complete, it never will be, but there's a lot of it out there. And I'm speaking as a former urban designer, urban planner. For the past 2 decades or more, there have been people interfacing between the health world and the design world, if you like, the planning, architecture, engineering, etc. So there's been a lot going on over a number of decades between that kind of downstream space and what I call the midstream space. So for us, the challenge was, well, what's happening further upstream from that? Who is in charge of making the decisions? Who are the clients responsible for the architecture? Who are the people controlling the land, the finance, the delivery, etc. And also, obviously, further upstream than that, the policy and even the international environments up to a point. But our focus was very much on cities and then the interrelationship between national government, cities, and private sector. So yeah, if we go back to this and then just think about buildings, I just wanted to use this as just a case study to try and sort of flesh out the sorts of things that we might be thinking about when we're thinking about how we develop our buildings in cities. So the way that we probably categorize it here, and this is a very loose categorization, but in the UK, is we split them between residential and commercial. And that's mainly because residential development has a very different business model to commercial development. Commercial development requires a lot of upfront capital cost. It's largely the preserve of institutional investors and big global real estate investors, those sorts of things. Certainly for city centres, I mean, it varies widely. And that can be for office and retail, but they effectively want a revenue stream over the long term, which is very different from residential development. It tends to be, I mean, it's different for social housing on the right there, but 80% of new homes in the UK are delivered by big volume house builders, usually sort of FTSE 250 companies, and they have very short-term cash flow business models. They build a house and want to sell it on, etc. But yeah, and then there's this growing build to rent market as well, which is relatively new in this country because we haven't had a very significant sector in that area for a while. And also just to give you a bit more of a flavour about some of the different challenges in each of those different areas. On the left is an article on from building design, sort of lambasting the quality of a lot of the big volume house builder developments. But that's not to say that volume house builders are the only ones with the issues, because as the image on the right shows, we've also got issues of affordability in our city centres, etc. So forgive me, that is a very, very quick ramble through, but I hope it gives you a flavour of the complexity of just one of those infrastructure systems. And obviously there are all those other infrastructures and how they interrelate. And we haven't even gone into all the various different bits of governance, the different tiers of authority, plus all the third sector, private sector, etc. that surround it. So highly, highly complex systems of systems. So on to TRUUD and what we're trying to do. We're funded by the UK Prevention Research Partnership, and their focus or their concern really is about non-communicable diseases and health inequalities. They actually, just as we were applying for this, they also amended that to include a broader conceptualization of planetary health as well. And in the second round of funding, they included planetary health in their description of what they were concerned about. So our focus in the first tranche of funded projects were mainly focusing on non-communicable diseases and health inequalities. But actually, in the TRUUD consortium, we expanded that out to include planetary health as well. And as it says down in the bottom, they were wanting to see new approaches to population health research that were considering whole systems, that were interdisciplinary, that were looking to test and evaluate multiple upstream actions, etc., etc. I've said this about planetary health, but this is the sort of formal definition from the Rockefeller Foundation Lancet Commission of 2015. And as you can see, it includes health, well-being and equity worldwide. Some people, when they talk about planetary health, include equity after the term planetary health. The reason why this is so critical, and in fact, our consortium spent about 6 months just talking about what we meant by health. And we agreed in the end that we all have varying understandings of health. And actually the important thing, and this is generally in the transdisciplinary literature, it's fine to have plural understandings as long as you're clear on what other people think they're talking about as well. So this is how we then reframed the problem for the TRUUD project in as simpler a way as we possibly can. But it's basically saying the similar thing to the upstream project. So you've got the non-communicable diseases in that round bit on the bottom left, and being influenced by the quality of the built environment, similar to the health map and the Dahlgren and Whitehead models for those familiar. And that obviously feeds into substantial costs, and there have been lots of estimates of what those costs are. But the problem is that those costs aren't getting fed back into the various different tiers of decision making upstream, particularly at national government level, because the UK is such a highly centralised system in the public sphere, and also because in the UK the private sector is dominant in many respects in terms of the control of finance, the control of land, etc., etc. So that was kind of our very simplistic description of the problem, or illustration of the problem. There are quite a few of us trying to get our heads around this, and we're still very much in the process of trying to get our heads around this. And it's been 4 years of us working together now. So there are 6 universities in a whole bunch of different areas, of course, public health, policy, economics, engineering, law, management, spatial planning, real estate, and there are a whole bunch of others as well. That's not the full list. And I'm not going to go into the details of this. There's a lot of text in this slide, so forgive me. But the main bit is the sort of bits in bold on the left in terms of methodologies. So we did 123 interviews with 132 people, and there was some very complicated, large-scale analysis of a lot of that, a lot of data that came out of that. There was also a number of workshops, systems workshops to support that, and Neil will, I'm sure, speak about some of this or allude to it. He was leading the kind of systems mapping of all that data, which also fed back into that. Another major theme, apart from the interviews and the workshops, was the economic valuation. So over the last through the upstream pilot and this project, we've been developing an economic valuation tool, which is now called House, and is being hopefully adopted by government for their appraisal guidance, and has been tested in Bristol and various other places, and it's generating a pleasing amount of interest. And also there was a sort of a back end bit, which was how do we try and sort through all this information and then identify where should we intervene in the system? What are our intervention areas? So that then fed into, there was a sort of summary of what the main problem areas were, and those are listed in the middle. So a lot of them won't be new to you guys. A lack of integration across government, lack of or too much short-term thinking, lack of agency at local government level, etc., etc. That ultimately fed through to 50 areas of potential intervention, and then we narrowed it largely based on the competencies of our team, really, but for a range of reasons to these final 7 areas. So corporate decision making, real estate investment, national government policy, city region transport, KPIs. It's not just KPIs actually, but city region transport, large scale property, law, and public engagement. And so we've reformulated the problem space into this. So these are the 7 different areas that we're seeking to intervene in that problem space. So I'm probably repeating myself, but government valuation tools. The second one, number 2, is a psychology-based intervention looking at how do we shift behaviour effectively within the private sector. The real estate investment is linking the valuation tool into real estate decision making, and that's currently being scaled up. It's still in the early stages. Legal understanding was mainly focused around the use of health impact assessment and gearing up local government officers and others in terms of what their legal rights, I guess, are, what they can and can't ask for legally in terms of health and health requirement. And then the transport KPIs and the valuation. There's spatial mapping in Bristol, looking at large scale urban development and health impact assessment. And at the combined authority level in Manchester, looking at how we integrate health from health economists and population health into their various different mechanisms at the combined authority level. And then finally, there's one on, we've called it amplifying citizen voice. It's changed a fair bit, but it's basically how do we try and short circuit, because there's so much consultation, public consultation that goes on in urban development all the time, all over the place. The quality of that consultation is highly questionable in many instances, but it's just so complex. We're trying to figure out how do we try and short circuit that. So the public engagement team are thinking about issues of, or could they try and develop new means of deliberative democracy, mini citizens juries, those sorts of things. And that's it from me. Sorry it was a bit rushed, but we've got plenty of time for discussion and questions later.
Thanks, Dan. I think you're handing straight over to Neil then.
Yeah, I think so. So I'm going to attempt to share my screen now, and then I think we're going to stop for some questions and a break after that. Is that right, James? Yeah. Okay. That's right. So if I share my screen, does it take over from yours, Dan? Let's try that and see what happens. Okay, can everyone see that one? Great. Okay, so yes, I'm going to talk a little bit more about TRUUD's use of systems approaches, primarily to map the problem and how that leads us to the point where we can identify leverage points and points of intervention, but really how we can understand how they're going to affect the system and how they might affect one another and collectively be changing the system, and think about maybe where the emergent outcomes of that might be. So early on in the project, we started wanting to understand a baseline set of principles of what it means to take a systems approach to this kind of thing. And we wanted to make sure that across the project we had an awareness